which of the following is the most appropriate initial management for this patient's memory impairment? Okay, 60-year-old man admitted to the hospital, found unconscious. He is unable to recall events leading up to hospitalization. He has hypertension, diabetes mellitus, recent fall with head trauma. CT shows no acute intracranial injury, hyperglycemia, and elevated A1C. Initial management for this patient's memory impairment. So it sounds like maybe a recent, okay. He's found unconscious. He has hyperglycemia and A1C. This sounds like it was maybe secondary to his diabetes management. And so initial management for this patient's memory impairment. I don't think he needs a benzo. It doesn't sound like he has like an alcoholic picture, so I don't think thiamine, I don't think CBT at this point. I would still probably go with optimized glycemic control.
Okay, good. Yeah, so if you were to point out, what disease in name that deals with diabetes that can cause you unconsciousness or memory issues or things like that, do you know what the maybe some diagnosis that I mean differential that deals with diabetes by any chance?
Like, was he in DKA?
Yeah, so DKA is one of them. Okay. You don't know if it's diabetes type 1 or type 2. You know what I'm trying to say? So DKA is one
Yeah.
of them. How about if it's diabetes type 2? Is there a really bad, disease with diabetes type 2 that can also cause you a little bit of confusion and things like that?
Um,
So do you remember? I'm pretty sure. Let me look. It's hyperosmotic, right? Like hyperglycemic event or something. Hyperosmotic,
oh,
hyperglycemic, right? So that's
yeah.
more of like a type 2 diabetes, right?
Okay.
So it just depends on kind of, it could be DKA, it could be that hyperosmotic, right? Just means that you have diabetes type 2, but your glucose is in the 600 range and you're like dehydrated because there's so much glucose, right? And all that stuff. And that can cause you, definitely for sure, consciousness issues and things like that. But, let's kind of go through the other answer choices here, right? So diazepine, right? Not the greatest to give in an older patient. If anything, that's going to make it worse, right?
Yeah.
IV thiamine, like you said, like Wernicke's is usually kind of, it can definitely cause you memory issues, right? If you're an alcoholic and have Wernicke's, but there's no alcohol history, so no reason to go down that path, right?
Yeah.
Initiate cognitive behavioral therapy, right? That's usually for psychological issues, right? Very good for adjunct for psychological issues, but no psych issues that he has here. And then memantine, right, is moderate to severe Alzheimer's, right? And so that's going to, remember, Alzheimer's is more of a chronic issue, right? Not an acute issue. So that's going to be memory loss over a prolonged period of time, not just an acute setting like here. So